Welcome to another edition of Hudson Health TV. I'm your host, Anthony Passannante. I'm a practicing cardiologist and also the president and chief hospital executive at Palisades Medical Center. This is October, and it's Breast Cancer Awareness Month. And in honor of that, we have two guests here today to discuss that with us. First, we have Dr. Deena Graham, breast cancer and gynecologic oncologist from the John Theurer Cancer Center at Palisades Medical Center, who will be speaking to us regarding breast health. As you know, skin cancer is the most prevalent cancer among women in the U.S. Next comes breast cancer. We have over 280,000 cases of breast cancer that will be diagnosed this year in 2021, with over 40,000 deaths anticipated. Early detection and treatment is of the utmost importance. For most women, screening should begin at age 40, but we will certainly talk more about that now. My personal experience with breast cancer, I want to just say, is that almost everyone knows someone who's had or experienced breast cancer, but for me it's extremely personal this year because one of my close family members was diagnosed, and we saw a lot of the trials and tribulations of diagnosis and treatment, and understand the great importance of getting diagnosis as fast as possible. Today I want to introduce Dr. Deena Graham. Dr. Graham will be talking with us today about breast cancer, and we hear, Dr. Graham, that many people during the last 18 months of COVID have not been getting the care that they need, screening exams, etc. Can you talk to us a little bit about the importance of returning to care, especially as it relates to breast screening and breast cancer awareness?
Yes, most definitely. I think that, like how many of our day-to-day and everyday functions have been disrupted with the viral pandemic, breast cancer screenings and mammographies over that time period were down by approximately 80%. And that was especially felt in minority and underserved populations. And I think awareness and knowing that it's safe to go back to your regular medical care and preventative care has helped that we've really seen almost an entire recovery of that. And I think what we've been trying to do is to make sure that our offices have, strict medical practices so that we are keeping people safe so that they can get their care safely and effectively.
Thank you. So Dr. Graham, in cardiology, we talk about risk factors all the time and how they predispose someone to coronary disease. Can you talk a little bit about the risk factors for breast cancer?
Sure. So when we talk about risk factors in general, we tend to talk about what we call modifiable or risk factors that we can change. And then there's non-modifiable, so risk factors that we can't change. And as you mentioned, breast cancer is one of the most common cancers diagnosed in women, and actually female gender is one of the greatest risk factors, which is, and then the other is age. And those are generally considered non-modifiable risk factors. And while genetics and family predisposition or close family members that have had a diagnosis of breast cancer are quite common, and we've all heard of that, about 80% of breast cancers actually are what we call sporadic, so have minimal to no risk factors associated with it besides age and gender. But some of the other risk factors that we can see are history of prior radiation to the chest, so patients that have had previous cancer therapies that included radiation. We also see, again, family history being linked. And the important things to know about family history are both maternal, so the mother side of the family, but also paternal history is very important. Even though breast cancer affects mostly women, still the paternal side of the family. And then it's also how many family members were affected, and then if family members were affected at a younger age, that suggests potentially a genetic predisposition. Alcohol intake and weight has also been associated with a slightly increased risk of breast cancer, and those are modifiable risk factors. So Those are things that we can focus on. Other non-modifiable risk factors are age at first period. Younger age can convey a slightly higher risk of breast cancer. And finally, there are some protective factors. So breastfeeding, for example, can be protective to lower your risk of breast cancer.
Dr. Graham, actually, we're going to give you a breath there for a second,
Sure.
and we're going to come back and talk a little bit more about those risk factors. But first, we're going to take a commercial break. Thank you.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Passannante Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Passannante Properties, building Jersey City for everyone.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Ford made their first all-electric SUV a Mustang. Rapid acceleration, reactive handling, 300-mile range. You control how it feels and how it sounds. It knows you. It dials into your preferred settings. It has an array of driver assist technology. Cameras and sensors enhance your awareness and provide you with additional control. But it's more than cutting-edge technology. It's the spirit of it. It's a Mustang.
Welcome back to another segment of Hudson Health TV. My guest is Deena Graham, an oncologist, breast oncologist, and gynecologic oncologist, and we were talking about breast cancer, and we ended the segment talking a little bit about risk factors. Can you elaborate on what people can do with respect to reversible risk factors, Dr. Graham?
Most definitely. So the most important thing is actually screening. Primarily mammography, and I know that one of my colleagues, Dr. Malone, is going to talk in greater detail about that. But screening and also speaking to your care team, your care providers about potential family history, any concerns that you may have, any lumps or bumps that you may feel, or anything that you're concerned about. Bring that to the attention of your healthcare provider. And in a lot of ways, you still have to be your own advocate sometimes. So really bringing those things to light is quite important. Other things are exercise, eating a well-balanced diet. There are some potential links to smoking, so obviously smoking cessation is important as well.
Great. So you had talked about genetic testing. Can you tell me how genetic testing fits into the testing regimen and the screening regimen that you do?
Sure. So genetic testing is typically indicated for patients when they are diagnosed with breast cancer at a young age, or people who have multiple family members who've been diagnosed with breast cancer. The ways in which genetic testing is done is either with a blood sample, like a blood draw, or a saliva sample, sort of a Q-tip in the corner of your mouth, so to speak. It usually takes about 2 or 3 weeks to obtain those results. And this can be done really through your gynecologist's office, through an oncologist's office, there are also other indications, certain types of breast cancer, regardless of the age in which you are diagnosed. For example, triple-negative breast cancer, the guidelines state that all of those women should have genetic testing. And for women who've had 2 breast cancers or a cancer in each breast, genetic testing is indicated for them as well.
And finally, Dr. Graham, can you tell us a little bit about the services that are provided at the John Thor Cancer Center at Palisades Medical Center?
Absolutely. So again, we offer screening mammography, ultrasound, and diagnostic biopsies that I'm sure my colleague Dr. Malone is going to speak about. From the medical oncology side, we offer genetic counseling. We offer risk reduction. So obviously, when you come to a cancer center, it's primarily patients who are diagnosed with cancer, but a lot of what we do in breast cancer medicine as well is actually prevention. So for women who are at a higher risk, either from abnormal but not necessarily cancerous biopsies, or a strong family history, we can see those patients, counsel them about what their active risk factors are and how to reduce their risk, either through lifestyle changes or potentially even medication. We offer comprehensive treatment for all types of breast cancer, including hormone receptor positive breast cancer, triple negative breast cancer, surgical services, radiation, and survivorship care. And as you mentioned, again, because breast cancer is so common, survivorship issues are very important. Maintaining a healthy lifestyle, making sure you see your primary care doctor and so forth. And we really take an active role. So even patients that don't have active breast cancer but have previously had breast cancer, we see those patients and make sure that they're getting the follow-up care that they need and deserve.
Thank you. So thank you, Dr. Graham. This was really helpful. I'm sure that the audience will certainly learned a lot from you today. And it's always a pleasure speaking with you. And it's really great to have your services on our campus. Really a great service for our community. Thank you very much.
Thank you.
Introducing the all-new Ford Maverick. A truck for people who do stuff. And people who make stuff. People like Gabrielle Union.
I make this look good, don't I?
Who haul whatever they want to wherever they want. Like wood to build things made of wood with. And friends to get weird with. It's for long trips that the standard hybrid engine with a targeted EPA estimated city fuel economy rating of 40 miles per gallon helps with. That an 8-inch touchscreen connects with. And any trip that this interior makes more comfortable. We'll let Gabrielle tell you all about it.
Or I could just tell them it's a Ford truck that starts at less than $20,000 MSRP.
Yep, that works too. The all-new Ford Maverick, built to defy expectations.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to another edition of Hudson Health TV. Today I have with me Dr. Carolyn Malone, one of our radiologists at the Breast Imaging Center in Palisades Medical Center. Dr. Malone works with the Hackensack Radiology Group and is a key member of the team at the Breast Imaging Center. Welcome, Dr. Malone.
Thanks for having me.
For those of our viewers who may not be familiar with breast imaging, can you talk to us a little bit about what mammography is and what other breast imaging modalities we use at the center?
Sure. So a mammogram is an X-ray image of the breast, which is used by a radiologist to look for signs of breast cancer. It's performed by a trained technologist who will place the breast in compression to obtain the image. Each image takes only a few seconds to be performed. Most patients indicate it is not a painful exam. It's usually used for screening, to look for early signs of breast cancer. It's also used as a diagnostic tool. So for instance, in women that have a symptom like a palpable area or focal persistent pain or nipple discharge, it's used to work that up. Each screening mammogram is typically about 2 pictures of each breast. A diagnostic mammogram is often more images than that. We also do ultrasound at the breast center, and we do a lot of different types of biopsies. So for instance, a stereotactic biopsy is a mammogram-guided biopsy, and also ultrasound-guided biopsies.
Very nice, thank you. So like many procedures in the hospital, sometimes preparation is required. Can you tell me a little bit about preparation that may be required for a mammogram?
Yeah, sure. So we always tell women not to wear deodorant on the day of their procedure or before, if they shower the night before. Don't put deodorant. It can actually create an artifact on the mammogram which can mimic a sign of breast cancer, and it could lead to unnecessary testing. We also tell women to think comfort. So wear comfortable shoes, flats, sneakers, wear a two-piece outfit. You have to remove your shirt and your bra for the exam, so you will feel less exposed if you have your pants on. We tell women to eat and drink as they usually would, take any medications as directed. What's also critical is that women bring their prescription, so the order for the test, bring that with you when you come. Another key piece is you have to bring any outside imaging. So if you've had a mammogram at an outside facility, we have to have those images to give you the best test. Mammography works best when prior exams are available. If they aren't available, it could lead to, again, unnecessary testing or an incomplete exam. And lastly, we always tell women, if you have any symptoms when you go for a screening mammogram, please be sure to tell the technologist, because they'll make sure that the correct test is performed.
And can you tell us a little bit about indications for mammography? At what age would you do, is mammography recommended, and how frequently it should be done?
Yeah. So screening mammography, when it begins, is really based on what a woman's risk for breast cancer is. So a woman who has average risk of breast cancer, the American College of Radiology recommends beginning at age 40 and having a mammogram every year. Women who are higher risk for breast cancer, so just for instance, family history, personal history of breast cancer, or the genetic predispositions, they typically would begin earlier. So for family history, the guidelines state you should have a mammogram 10 years before a first-degree relative who is diagnosed. So let's say your mother was diagnosed at age 45, you would begin screening mammography at age 35. Women with a personal history of breast cancer should have screening every year after they're diagnosed. Women with the genetic predispositions for breast cancer, the guidelines typically state you should have a screening modality at age 25. The newest guidelines actually say at 25 you would start a breast MRI, and then at age 30 you should have a screening mammogram every year. I really caution that anybody that thinks they're at high risk for breast cancer should really see a breast specialist and have what's called a high-risk consult and let them manage your care.
Thank you. Good advice. So can you tell us a little bit about the instrumentation used for mammography? You know, we hear about different types of machines, and I know at Palisades we have a 3D tomo machine, tomosynthesis. Can you tell us a little bit about what that means and why it's important?
Sure. So tomosynthesis, which is a 3D mammogram, is essentially multiple X-ray images through the breast, which are then computer generated for a radiologist. It creates slices that we can scroll through. It allows us to see through the breast more clearly. We can see smaller cancers. Also, equally important, we can see that an area is in fact just normal tissue and not something of concern. It means less women are being recalled from screening mammogram for a false positive, and also smaller cancers are being detected.
Thank you. And is it important where you go for your mammogram? Does that really matter? Are there different types of places to go, and is quality different? Is one type of a facility recommended over another?
Absolutely. I strongly recommend women go to a facility that specializes in breast care. These places are going to be the most equipped to give you a comprehensive examination, accurate diagnosis. They're going to have well-trained staff. So from radiologists to also pathologists who will they essentially give you the diagnosis from a breast biopsy. They're going to have trained nurses and technicians. It's very important to go to a place that specializes in breast care. And they're going to have the best equipment as well, just like we spoke about with tomosynthesis.
Thank you.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to another episode of Hudson Health. Today I have Dr. Carolyn Malone with me talking about breast imaging. She's a breast imaging specialist at Palisades Medical Center. Dr. Malone, can you tell the audience more about our breast radiologists and the rest of the team?
Sure. So all the breast radiologists at Palisades are not only board certified radiologists, but we've also all done extra training specializing in breast. It's called a fellowship, and typically it's an extra year. So we're all highly trained to be reading breast imaging. We also have a great team that works with us. We have nurses. They are very important for patient care, especially when we do biopsies, okay? They really make sure that the patients are in good hands and all the aftercare instructions. We also have technicians who only do mammography. So they're very well trained. We have great coordinators who are critical, actually. They help patients before they even step foot in the department. Our coordinators can facilitate a patient to understanding what their prescription needs to say. They also help patients get their prior imaging, because again, I've talked about how critical it is for us to have the prior mammograms. Our staff help patients with this.
This is really a comprehensive program rather than just an imaging center, I think, which is really important difference.
Absolutely.
So we've just come through the 18 months of COVID, and we're now doing vaccination for the last, actually quite 8 months now. And I've heard in the news that the timing of vaccines and mammograms presents some challenge. Can you talk a little bit about the timing of mammography and whether it's important to delay mammography after a vaccine, since vaccines will certainly be with us for quite some time, I think?
Yeah, absolutely. So what's basically happening with the vaccine is it's creating false positives on the mammogram, but really it's in the armpit, the axilla region, which is also included on the mammogram. What we're seeing are prominent lymph nodes, because when you get the vaccine, it's stimulating your immune system. One of the biggest parts of your immune system are your lymph nodes. So they're enlarging because they're reactive. Unfortunately for us, that can also be a sign of something that's concerning. So we are advising women, so the key is for screening mammogram, if you have the vaccine, to delay your mammogram about 6 to 8 weeks afterwards. It's critical to note, though, if you have a symptom, a palpable area, you should not delay your care. You should come immediately. I also caution patients that even if you wait that 6 to 8 weeks, the radiologist may still see, a prominent lymph node, and that can be expected, and it's not time to panic, and often we're doing short interval follow-ups.
Right. So we mentioned that in respect to COVID vaccine, but does it apply to all vaccines?
Yes. So it's not just the COVID vaccine. We're actually in flu season. So everyone is getting their flu vaccination. It has the same effect. So it's important that if you have your flu vaccine and you're going for a screening mammogram, you also should do the 6 to 8 week delay. And honestly, there's other vaccines, the pneumococcal vaccine, shingles vaccine, so they all have the same effect and the same rule applies.
Very helpful, thank you. So can you tell me a little bit about more of the other services that are provided at the imaging center?
Yeah, Palisades Breast Center is a newly renovated, state-of-the-art facility. We offer all the latest technology. All our mammogram units are tomosynthesis capable. We have ultrasound imaging. We're doing a lot of screening ultrasound. That's important for women with dense breasts. We're realizing more and more that women with dense breasts, there's a masking effect. So a small cancer could be missed, not because the radiologist makes a mistake, it's just very difficult to see. And we're realizing screening ultrasound is very helpful in that scenario. So we offer that as well. We do all sorts of biopsies, mammogram-guided biopsies, ultrasound-guided biopsies. We have biopsy equipment that allows us to biopsy very faint areas, hard to see, or areas that are hard to reach in the breast. There's many other facilities that some of these harder biopsies would say, we can't do it and you'll need to see a breast surgeon to have surgical excision. The goal is always to avoid surgery, which is a much more invasive procedure. We also offer same-day ultrasound biopsies. So let's say a woman has a palpable area. She can actually have her mammogram and ultrasound imaging in the same day, and also the ultrasound-guided biopsy. She'll leave with all her care, everything taken care of. It saves her time, and it's less time that she has to worry going from one facility back again. And lastly, what I'll say is our team is outstanding. They always go above and beyond to make sure every patient has a positive experience.
And I think that's so important. The patient experience has become an important buzzword, but more importantly, it's really it's the way we provide care, and it really is so important to us at Palisades and at Hackensack Meridian Health. So we certainly appreciate that, the comprehensive service you perform, and certainly the patient-friendly environment that they can get that in. So thank you very much.
Absolutely.
One question I had, actually unrelated but to that last one, was when are the different modalities used? When is an ultrasound used rather than a mammogram, or are they always done in conjunction with each other?
That all has to do with age. So if a patient is below 30, we typically would start with ultrasound to evaluate a symptom, again, a palpable area. The mark is, so 30 and above, that's when you would start with a mammogram, and we just about always do an ultrasound to look at some, an area of concern,
right.
Clinical. Yep.
And do when is the difference between a diagnostic and a screening mammogram? Is it actually a different procedure, or just is it just the diagnosis different?
It is a little bit of a different exam. So diagnostic mammogram is usually more pictures. So for instance, somebody has a palpable area, we do what's called a spot compression view. It really can help to push that tissue out and to see better, again, to see if there's a small cancer or just normal tissue in that region. So again, it goes back to why it's critical that if patients have a symptom, you have to tell the technologist, because you don't want to have a screening exam if you have a symptom, because you want more of those images performed, which could be more diagnostic.
Right. Well, thank you very much. Well, and I want to just thank you again for coming today and speaking with us. Again, I think our audience is very fortunate to have this facility in our community, and I think we certainly are happy to be able to educate them on the services that you provide. So this is Anthony Passannante again. I want to thank the audience for participating today. I want to thank Dr. Carolyn Malone and Dr. Deena Graham for their participation today. Great effort, and we look forward to speaking to you again in the near future. Thank you.